Nelson, and you're listening to the Starting Block Podcast. Guys, if you are new to the show, this show is for complete athletic development. The objective is to give you, the athlete, you, the parent, you, the coach, the tools that you need to win. That's what this is about. Now, we are slightly different than your standard podcast. We actually have shows within our show. So the first episode that you're going to typically hear from us will be a Q&A. That's going to be a bi-weekly episode where Chris and I break down your questions. Chris, my co-host, is here. What's up, buddy? How are you?
Hey, guys. Good to be here.
Yeah. Guys, Chris, where can people submit those questions?
Fast and Agile 49 on Instagram.
Yeah. So you can, if you're been listening for a while, we had some issues with the email server, so that is actually down. So you can just hit us up on social media. Chris just gave you his. Mine is Farmer John ELP, and we'll be happy to tackle some of those questions there. Next episode is going to be a guest interview. That's going to be just like every other podcast on the planet, man. We're going to bring in guests, colleagues, friends from across the world, and they're going to share their stories, share what they do with their patients, their clients, their gyms, and their practices, and that's what we have today, and I'll bring our guest on here in just a second. And the final two episodes, you're going to get an athlete highlight from us a couple times a year. Just an athlete that's been through the programs that Chris and I implement, the programs that we talk about here on this show. And they're just going to share their stories of success and kind of how the system impacted their athletic career and their life. And then you might get that final episode of Friday Fire episode maybe once a quarter where just something about our industry, something going on, something that I experienced that I just thought was beneficial for coaches, both ones that have been in this industry a long time and new coaches as well, because I know we got a lot of you guys that are just starting out or younger coaches and just something I think that we can all benefit from. So that's how the show operates, guys. We don't run ads on the show. We do ask, though, that you please pay your dues. Pay your dues and share the show, man. We do this to try to help spread the message, and if you support our mission, if you believe in what we're talking about and saying, if you got value out of the people that we bring on, hey, guys, just share the show and bring us a friend. That's all we ask for. So I think that covers it. So, yeah, what's up, man? What's new with you, Chris?
About the same old thing, different day. Training volleyball and training athletes of every sport. So, yeah, a little bit of the same thing. So, occasionally treating the injury, but by no means at the level of you or Dr. Luckey, our guest. So, yeah, I'll learn every
nice
time.
Nice segue there, man.
Yeah, we're just like, anything I can learn from, this is awesome.
Yeah. So, yeah, guys, we're joined today by Dr. Rob Luckey again from Pittsford Performance Care. So, welcome back to the show, Doc.
It's nice to thanks for the invite, fellas. I appreciate it.
Thanks, Dr. Rob. Yep.
Yeah, I'm glad to be here.
I think the first time we did an episode with you, I think it really, what's the word I'm looking for, really sent kind of some shockwaves out there. I think people were really blown away by the information that you presented, and like I was telling you off air, I mean, I have sent your show to so many people that I've lost track of it because I felt like it was just a great show, but you brought in, you said a lot of good things, and I think just things that people haven't heard, just the things you were talking about with concussions and I guess mainly concussions. That was kind of the big one. I think you kind of became the concussion guy after that episode.
Yeah, well, it's a big part of what we do during the week, so I am pretty passionate about it. I enjoy working with those cases, and I think there's a lot of education that needs to happen. So having this forum I really appreciate it.
Yeah, no doubt. And so, yeah, I think, guys, that's what we're really gonna talk about that a lot today. And so if you haven't checked out the first episode, you really should. We're probably gonna build off that one. I want to say, Chris, that episode is probably in the 20s-ish, so it's pretty far down the feed, guy.
Yeah,
but Dr. it's a great
Rob
episode.
Luckey, look it up, Dr. Rob Luckey. Yeah, it's in there. It's in the title.
Yeah, you'll enjoy it. There's a lot of great info there. So I think we're going to build off that. And Chris, we started our conversation off. You had a really good question for Dr. Rob. Why don't you bring that back up? Let's go through that again.
Okay. Well, yeah, I'm really just curious. Is it environment today? Is it diagnostics today? But I'm going to lay out a little background here. I mean, I broke. This is just my own personal experience. Okay, I broke 2 windshields with my head as a child. All right, in car wrecks. I was not driving either time, okay? I have a fractured skull on the the back of my skull, which I know explains a lot. But it was found by an X-ray years later. By when I went in to have my neck X-rayed for a neck injury, they asked me who hit me in the back of the head, and I was like, I don't have a clue. And they're like, well, this is an old fracture. It's healed, and you should be. It looks like you're okay. So I was never diagnosed with a concussion, like ever. Is it, or was I? Do you think I probably had one based on those things? Was it most likely that I just, maybe I had symptoms and ignored them and basically just went on with life, and eventually the symptoms went away? Is it just easier to get a concussion for a kid now? Is there some amount of like environmental? Um, I mean, what's going on? I mean, why does it seem like it's so prevalent today?
Yeah, you posed two or three really, really good questions in there. I think the first thing I'd like to comment on is, why did they not diagnose you potentially with a concussion if you more than likely had one with those traumas, right? I One thing I would say is this is interesting. I had a colleague bring this up to me maybe just 3 or 4 months ago, and I did a little research on my own because I wanted to make sure it was accurate, but it sounded accurate. His statement was, medical neurologists, when they're going through med school, prior to the year 2000, I don't think there was a med school program that in the neurology track was teaching the pathophysiology of concussion. So if you think about it, most neurologists that we would go see are in their 50s or 60s because they have to do so much school. So the likelihood that their original training dealt with the appreciable changes that occur in a concussive event outside of the the major trauma of like a fractured skull or a brain bleed or some type of hydrocephaly or stroke event, they don't have that training. So then it's like on the job training, which I'm sure is much more available today. But that's on them whether they choose to get that or not. So I thought that was pretty interesting. One. Two, I also find clinically, for me, when somebody experiences an event, a head trauma, and they go in and get evaluated by the hospital or the ER, the whole job of the ER and the priority there is don't die, right?
Right.
Let's make sure that you're leaving the hospital under your own power, right? And so if there's nothing that needs surgical intervention, they're going to send you on your way. And honestly, the likelihood that you have trauma, that you have symptoms outside of maybe headache or maybe some blurred vision or maybe a little nausea is relatively low. It's in the days after that those symptoms really, really hit the fan.
Well, yeah. I mean, I was just kind of curious because, I don't remember having any significant symptoms. I mean, I don't remember. It's which I mean,
Well, the other piece to it too is the symptoms don't have to be what everybody thinks of, right? So the traditional symptoms are double vision, vertigo or disorientation or a sense of being lightheaded or like you're on a boat, headache, that's a very classic one, nausea. But one of the most major symptoms is just fatigue. I mean, you'll see this with your athletes. If they take a concussion, you can just see it in their eyes. They just look tired. They could have just come off taking a nap or, coming off a very restful weekend and they just look exhausted. But sometimes those concussive events, they play into very different symptomatology. It's not like the ones we just discussed. It might create anxiety. It might create heart palpitations. It might create drop attacks. It might create visual disturbance that's hard to characterize. It might create digestive symptoms that seem very unrelated. Like it really slows your digestion because of the parasympathetic input, because of all the autonomic dysregulation that happens with a concussion. It can dramatically affect sleep. A big one is it affects appetite. I tell parents all the time, there's 4 things to look at your kid. If their appetite changes, if their energy changes, if their sleep changes, and if their digestion changes. As a parent, we just kind of are always feeling the rhythm of our kids. So if one of those 4 is off, or 2 or 3 or all 4, it's pretty likely they, sustained an event.
So to build on that, I don't have any research or evidence to back this up. I got an article here that I pulled up from 2020, and it was done by the American Academy of Orthopedic Surgeons, and essentially it said that ongoing studies show a continued increase in concussions amongst high school athletes.
Yeah, I'm glad you brought that up.
Yeah, I feel that I have seen an increase in the amount of kids that have had concussions recently, particularly over the last couple of years. I mean, one of the football teams that I work, I think they had 4 kids get a concussion in one day, like one game. Are there any, to build on Chris's question, have you found, are there any other factors that are playing a role in this? Like, why has the human brain become so vulnerable seemingly?
It's a really great question. I have a lot of theories around it. They're not research based. They're just from being in the room and, being in the ring, trying to put these brains back together. I would say, and you guys will probably have a comment to this because it's the work that you do. We were athletes, and when we were in our development years, we had 1 practice and 1 game a week, even if we played competitively, and then we played with our buddies, And now, at least in the area that I'm in, these 11-year-olds will come in, they'll have 5 practices a week. They'll travel to Delaware on the weekend for 8 games. Practices are an hour longer than they used to be. And the kids are faster, stronger at a younger age. So that's just a mathematical probability that their exposure to injury is statistically higher than it was years ago.
Sure.
That's 1. 2, I am beginning to recognize that there's an epidemic with kids not fueling their system well. Like even yesterday, it was Monday. I was doing new patient exams on the musculoskeletal side of the practice. I had 3 kids in a row. One was 14, one was 16, and then one was 15. And all 3 of them, I was like, okay, how's your nutrition? And I usually ask them to give them a grade, A, B, C, whatever. And they're all like, oh, it's an A or a B. And in every situation, I was like, what'd you eat for breakfast? Oh, I didn't eat breakfast. What'd you eat for lunch? I had a muffin. I'm like, we're halfway through our day and we haven't had anything substantial. So I'm pretty convinced that the energy drinks, the lack of appropriate nutrients, and the sheer exposure to trauma are 3 pretty major aspects. And that's without even going into the conversation of screen toxicity, sleep, whatever, all those which.
Yeah, let's go into that.
let's go into that, especially the screen toxicity thing. Yeah. I mean, we have those conversations with our clients and athletes all the time. We just had Dr. Alexis come on. We've had Dr. Cruz come on, talk about, the benefits of light and sunlight. I mean, are you seeing the ramifications of this, what you call screen toxicity?
Yeah, absolutely. It's just part of the story. It's another major factor. It's just, man, and I have a 10 and a 14-year-old, and I feel very strongly about it, and it's hard for me to manage it with my own kids. So, and then you take the average parent who doesn't necessarily have training in neurology or brain health or even just basic lifestyle, things that have been sliding in a bad direction, and it's hard for me to manage. So it's definitely a problem. It's definitely a problem. It creates a underlying fatigability in the brain, which you guys will appreciate this. As soon as the brain begins to lose energy and it can't produce the same total output, it affects your speed of contraction. And when your speed of contraction and your whole system goes down, that's how you protect yourself. It's about force absorption before it's about force transmission. And so the joints become vulnerable. The muscle tendon junction becomes vulnerable. Joint stability becomes an issue. So
why do these things become so vulnerable?
Well, if we're talking about a performance athlete, if we want to simplify the brain muscle connection, it's speed of contraction, it's symmetry of contraction, and it's sequence of muscle firing. If those three things are happening at a high level, the likelihood of injury goes way down. So I know you guys both appreciate, like, we think about injury recovery probably very similar. We have to reverse engineer that process, right? But if somebody is fatigued because the brain has inflammation, because it's exposed to too much screen time, or very poor diet, or they had mold in their basement, or they had two concussive events relatively close together, or they swam in the lake and they got an ear infection and it traveled along the vestibular nerve to the brainstem, and now we have a systemic inflammatory situation. Or I can't tell you how many patients I had, adults with COVID, that got to the brain. It was like a magnet to brain tissue. So, I mean, infections, there's a large list that can impact brain tissue. And when that brain is inflamed, it can't produce the same amount of ATP. It's hamstrung. I think we talked about this last podcast, but I think it's worth mentioning again. A neuron will take a little molecule of glucose and a little molecule of oxygen, and it has a high potential to create like 32 units of energy in the perfect system. If that neuron is exposed to inflammation, it will produce 1/16. So I'm not saying these kids are walking around with their whole brains inflamed, but even if it's partial, they're starting their day with maybe 3/5 of a tank. And then you ask them to go on a field and explode and change direction and protect themselves. And it's like an invisible drain on the battery. And then all of a sudden we're like, well, why are these injuries happening at such a rate? Like you said, John, 4 concussions in one day?
Yeah.
Yeah, those are individuals that are not protecting themselves.
What
were you going to say, Chris? Because I got a question follow up on that.
Oh, well, no, it was along the same line as well. I mean, is this slowing down of the metabolism, or this inflammatory effect, the lowered energy in the brain, so to speak, is that a result of that? Because you're hearing a lot about blue light, blue light toxicity, whatever. Is that specifically what that wavelength is creating, or is this just
partially? Yeah, the blue light toxicity will create fatigue relatively quickly in the brain, and part of the reason is your visual system. Like if you think about a computer, right, and you think about the CPU, right, and it's like I'm way out of my lane right now. You guys know talking about computers, but certain programs pull a certain amount of memory, right, and so the visual system pulls the majority of the brain power consciously. The muscular system pulls the majority of brain power subconsciously. So like for me to walk around and stand up and have, power against gravity, so I have good posture, that's all subconscious, right? I'm not thinking about standing up straight. My body does it naturally. That system pulls a lot of power from the brain. The visual system in a conscious way is drawing a tremendous amount of energy, especially when you're 6 inches away from a stuck in a blue light.
Yeah, isn't it like doesn't the optic nerve take like 84% of the energy?
Massive. It's massive. I don't know exactly what the percentage is, but I know it's in the like 60 to 80%. I've heard before. Yeah.
So you made a reference to, you don't know if kids are just walking around inflamed, or I mean, again, my belief is subjective, but I feel like they are. I mean, there's so many things this day and age that are impacting our life in a negative way. But I want to get into more of the neuroinflammation side of that. What is your thought on the lymphatic system functioning and its influence in, your neurocapacity or even recovery from concussion?
I think, well, it's one of the primary systems to detoxify the body. So I think, especially early on in a concussive event, it's a really gentle way to support a patient and help them start moving in the right direction. Supporting those detoxification pathways is one of the early conversations we'll have with the patient. So lymphatic drainage, or even just like doing really gentle work on a trampoline that's not irritating their vestibular system, but just getting some movement, swimming, lymphatic massage, a lot of breath work. And then we'll go into, I think we talked about it last time. I'm a big fan of things like glutathione and things that drive antioxidant work, especially to brain tissue.
So I asked that question in relation to what you were saying earlier, but I made a comment to one of our healthcare providers. She came in and we were discussing, I feel like recently it's almost becoming more difficult to help people. I feel like 6-7 years ago, it was, you can use, whatever tools, people were able to heal a little better, I guess is what I'm trying to say. I feel like that has changed a lot in the last 3 to 4 years. And I feel like that coincides with this increase in concussions and increase in injuries.
Yeah, John, there's a tremendous amount of wisdom in that statement. I agree with you. I couldn't agree with you more. And the way I would tell you is, like, anecdotally in my practice, I do new patients on Monday that are musculoskeletal, and I'll usually see 8. And then I'll do 8 neuro new patients on Wednesday. And it's like every hour. So I have an hour with these patients. And it used to be that I was inundated on Mondays and I wouldn't have that many on Wednesdays. And now it's like inverted. It's the opposite. Oftentimes patients will come in through that musculoskeletal door and they'll be like, hey, my ankle hurts, or I got plantar fasciitis, or I got chronic knee pain, or my hips just won't get better, or I got sacroiliac, whatever the complaint is. And we used to be able to do 2 or 3 visits on a really thoughtful neuromuscular way, and the patient's so resilient, it's like back to good, super fast. Now the only time we're really seeing that is like the very young patient that truly is still neurologically very healthy. So we still can see it, but it's in kind of a much smaller demographic where they're resilient. Adults have lost that, and that pediatric athlete, that 12 to 18, doesn't have the resiliency they used to.
So why are we seeing that? What has happened here?
So I think it's a couple. I mean, I think it's what we've already kind of brought to the table in the discussion, but I also think that general medicine, like pediatrics, I don't think they're turning a blind eye to it because they're very smart people, but I don't think they're aware of the ramifications of overloading the brain when it doesn't have enough energy. So, and there's so many things that there's all these invisible drains on that system. I mean, we already talked about it. It's the blue light, it's the poor sleep, it's the not enough nutrients. There's not enough protein, there's not enough fat in their diet. Their brain needs to like be resilient and have those nutrients, and they're drinking energy drinks instead. Yeah. I think the load on their body is unfortunately, there's too much endurance activity, in my opinion, happening in this age group, and it's causing a lot of fatigability on the neuromuscular system. And then these injuries stack up.
Well, I remember you saying, Dr. Rob, I mean, in our very first interview, I mean, I'm going back almost 2 years. You even mentioned then, though, that a lot of times when someone has this, I think it was like a recurring injury or an injury that just wouldn't quite resolve.
Yeah.
Very frequently, they had some unresolved, like old concussion. Like that is not uncommon for an unresolved concussion to lead to a, either one injury after another, or maybe
Oh yeah.
one injury that just won't completely resolve,
Mhm.
or just susceptibility across the board. And I remember that from our first podcast. So I mean, it's. I mean, could you?
Yeah. To maybe to take that and just make a side comment and then come back to what you're saying is, when I sit in front of a patient, especially a parent that's frustrated because their kid is they're struggling. They've been to many specialists. They're trying to figure out why this chronic injury is not getting better. And I will oftentimes say to them, and I'm sure you guys probably think very much the same way. It's like if an injury has traveled from an acute response, right? An acute response is 5 to 7 to maybe 10 days, right? You bruise your arm, the bruise is gone, right? That's an acute response to injury. As soon as it crosses over and now it becomes a chronic response, the only reason something becomes chronic is either there's a structural barrier that hasn't been discovered. Maybe there's a stress fracture. Maybe there's, I had a kid yesterday, he's been dealing for 2 years, and he had an interspinous tear in his spine, like the ligament was torn. If there's a structural problem, that can lead to chronic pain or chronicity in recovery. But if it's not structural, it's neurologic almost all the time. And so then we just go, then now it's time to hunt. Now we just keep hunting until we find it. And the reality is we've stacked up so many of these cases that it links back to a concussive event that it's almost like it needs a new profile or some writing on it or just some education, because it's ubiquitous. It's everywhere. It's everywhere. Yeah.
So you made a quote or a statement that became a quote in the first episode that I have definitely stolen and used repeatedly. You said physical injuries get better over time, and neurological injuries get worse. So this will tie into what you were just saying. Things have been around for a long time, and you can track these back to their post-concussive events that occurred. Yeah. What are some other types of, long-term post-concussive stuff that you see? I know you mentioned fatigue, but what other things are you seeing to help maybe like problems making, decision-making, hormone irregularities, task sequencing, all kinds do you see those types of things as well?
So you can actually, I don't know if I can spin my phone around to show you, but there's a pyramid that I was just teaching to a school district that's trying to appreciate the relationship between neurology and learning, right? And so if you think about this pyramid of like development, so it starts at the bottom and it's your survival reflexes, right? Like the ones that you would know, your primal reflexes, your reflexes so the baby eats and doesn't fall out of the crib and knows how to grasp. Those reflexes, by the time they're 18 months, they're now they're not gone, but the brain has developed in a way that those reflexes don't exhibit themselves, right? Unless there's a developmental issue. Then we go into your motor reflexes. Those are the ones that help you with your gait, or like your cross extensor reflex or something like that. Then you get into your basic movement pattern. Oh, I missed one. Then we get into your autonomic regulation, which is like your support. The way to simplify that is just to say that the brain knows how to get blood to where it needs to go when it needs to go there. So if you're going to communicate, it goes to your brain. If you're going to eat, it goes to your gut. If you're going to run away from the tiger, it goes to your big muscles. If you're going to be intimate with your spouse, it goes to your sex organs, right? Like your brain knows where to shunt blood. That autonomic regulation is insanely important, and it needs to be accurate. Then we go to basic movement. Then we go to coordinated movement. Then we go to cognition, behavior learning. So to what you were just saying, John, like with memory recall and deductive reasoning and linear thinking, those are all at the top of the pyramid. So yes, if anyone has a foundational problem with a trauma or some type of neurological injury that has affected anything in that pyramid, it's absolutely going to affect memory, learning, cognition, for sure, for sure.
So then that would take us into the next step here is what are those steps that we look at and take when trying to help somebody recover from a concussion? Would we say that, getting the autonomics back on track is priority one?
Yeah, it really is. It really is. So oftentimes I'll tell a patient, we'll do the majority of the work in-house because brain recovery needs high specificity. It's like giving your athlete like the most perfect exercise, and then all of a sudden you see them have a trampoline in their training, like literally like, whoa, I didn't expect that. But you happen to give them like the one most valuable thing you could give that individual at that moment, and it just hit perfect. That's the goal of every minute we spend with that brain patient, is like, how are we teasing out what's the right thing at the right moment? But from a more generic standpoint, regulating the autonomics is really, really important, because if the brain is not getting appropriate blood supply, or the heart, or just circulation to make them feel connected to the ground and stable and safe, it's very hard to repair. Now, the best way to create support and stability of the autonomics is actually to just go to the sensory systems: hearing, primarily vestibular, primarily visual, and primarily somatosensory, like proprioception. And then there's obviously, tactile touch, and there's a few other ones, the sense of smell. But it's really primarily vision, vestibular, and proprioceptive. Go ahead.
No, go ahead. Keep going.
I was just going to say, if those three sensory systems are at least accurate, they don't need to be robust. They just need to be accurate. As long as they're accurate, now the brain can begin to feel safe. And with an autonomic dysregulation, like the medical term is dysautonomia, or sometimes you hear like POTS, with those patients, you have to fix them with very little gravity, and you start them laying down, and you recalibrate those sensory systems here, until it's very comfortable and normal for them to be upright and regulated.
So getting the autonomics back in working order, I feel like traditionally that's just kind of just rest and don't do anything for a long time, and it'll, things will just get back to normal. That's kind of one way.
Yeah.
But then I've also seen and heard other, practitioners that start right away with a therapy of some kind, whatever that may be.
Yeah.
But like in my brain, and again, I'm not the medical practitioner, but in my brain, I feel like if you think of concussion like a shock, your brain is just in a state of survival at this point, just locked in this sympathetic phase. Why would we want to start to automatically introduce additional stimulus? Why wouldn't we want to try to get the nervous system back in that parasympathetic state? It's like
very
you're
well
doing
said.
more damage without
super
getting that.
You're saying it right, John. You're right on. If you take the last 100 patients that have walked into my office for brain rehab, probably 95 of them would tell you they've already had rehab and it was too fast and it was too much. So the brain is a stimulatory organ. It's very, very hard to inhibit brain activity. So and in a perfect world, what they really need is to relax the brain and support it and make it feel comfortable and give it slow energy, like diesel fuel, not like sugar. And so there's a real art to it. There's the science of it, and then there's an art to it. And and I've come to really appreciate that there is a heavy art to TBI recovery, to brain recovery. So we go real low and slow. We get patients, almost all of them are taking glutathione at the beginning or some version of that to try to pull inflammation out of the brain so they can at least start to begin to feel like the body can be produce some ATP. But the problem is that if there's quite a bit of dysregularity in pathways, like in brain pathways because of the trauma, right? Brain takes a trauma, goes helmet to helmet, the brain gets scrambled. It loses its maps. It doesn't know where its center of gravity is. It doesn't have an appreciable way to determine acceleration of the head. The eyes don't know where they are. They don't know how to see the horizon line. As soon as they get out of bed in the morning, they go into 160 heartbeats a minute because they don't like how they feel on the ground. And so we need to get the inflammation out, and then we need to figure out, here's the next kind of secret sauce to it, is we need to figure out what system still has good integrity. We need a guidepost, right? It's like walking into the basement. As soon as you can grab the handrail, now you feel confident where the next stair is.
And so by which system are you referring to? Vestibular, visual,
Whichever one still has health. So we need to figure that out. The hard cases are when there's no guidepost. Everything's blown out. Vestibular system sucks. Vision system's terrible. Proprioception, they don't know, if you're touching their pinky toe, they think you're touching their second toe. They're standing, they close their eyes, they fall over. Those are the cases that are really challenging because you have to create an artificial guidepost to help rehabilitate the brain. But when it's more minor, they still might be very symptomatic. But you can say they have great vision, but their sense of orientation is terrible. Well, great. Do the rehab with their eyes open, because the brain feels somewhat stable when they can fixate those beautiful, strong, accurate eyes and give them ipsilateral, one-sided input until you create neutrality and the brain's like, oh, that's where midline is. Or you could do the opposite. Maybe someone's vision is really screwed, but their vestibular system is really stable. Like maybe they're a snowboarder and you put them upside down and they still land on the ground. They have a great vestibular system, but their vision has visual skew to it. Well, there's ways to use that vestibular system as a guidepost so you can recalibrate binocular vision. So that's one of the big pieces of what we do, is to try to figure out, where are they healthy? Where is the system way out of sync? And can I use the one to help the other?
You're always just going to find what's strong and use it to help rehab what's weak or what's not working.
Yeah, absolutely.
In a nutshell.
Yeah.
Now, you talked about going low and slow with this process, and by that, I assume you mean by monitoring their metabolic threshold through this.
Exactly, 100%.
So I think there were a lot of questions about that in the last episode. Can you dig into the metabolic threshold and why that's so important?
Sure.
Things that you're looking for.
Sure. Yeah, that's a really important comment. So the bad things are when you exceed the metabolic threshold, you create symptoms. You're inevitably, arguably going backwards with a patient if you exceed their threshold. You can do it as a practitioner, or you can not give the patient good recommendations and let them do too much, and they can easily exceed their threshold. And then the other challenge is when they begin to start feeling better, they've stacked up all these things they want to do. Like, oh, I haven't thrown in a while. I haven't seen my friends in a while. I haven't been able to go to the mall in a while. There's like 6 movies I haven't seen. So all of a sudden they start feeling better and they do everything. And then they blow through their threshold. So I try to tell patients that for the next 2 weeks that we're together, 2-3 weeks, I don't want you to manage your schedule anymore. I want you to manage your energy.
Well,
really
by the way,
important.
I want to back up to John's last question because measuring that threshold.
I'm going to try to answer that for you.
Yes.
So the patient intuitively knows when they're getting close. They really do. They don't feel well. their autonomics become really quite dysregular. Their temperature, their thermoregulation becomes poor. They get jittery. Their heart rate increases. They get sweaty. These are all the precursors of crossing that threshold. So there are symptoms that will arise, and I try to educate a patient about that, because it's not like they're walking around with a pulse ox or they're not wearing glucose monitors. We don't know where their glucose levels are. They're not walking around with a blood pressure cuff on. So it's really hard away from the office for us to be like, hey, I'd love to be able to create an app somehow, like a constant glucose monitor, but it's like it's a metabolic threshold monitor. I mean, that would be amazing. And if it like alarms them, hey, Amber, shut it down, So I try to have those conversations in theory with them. That was you're not managing your schedule anymore. You're managing your energy. If you feel perky, if you feel like your mood is high and you want to get a little work done, get a little work done. As soon as you start yawning, or you're having to squint your eyes, or your eyes feel dry, or you feel tired, you got to shut it down. Go take a rest. Go close your eyes. Now managing that in the clinic is a heck of a lot easier, right? Because we'll use an O2 stat the whole time, and say, they should be living at 99 to 100, but our brain patients are probably living at more like 96, 97. The really sick ones, the really damaged ones, are probably living more like 94, 95. And so when we're doing brain rehab and the brain likes it, we call it brain friendly, you're going to see that O2 get closer to 100. As soon as the brain is getting tired, like you did one rep more than you should have, you'll watch it drop down 2 points like that. And then we're like, done.
Yeah.
So it can be frustrating for a patient, because they can come in, expect to be with me for an hour. We do 7 minutes of stuff, and then they're laying down for 45 minutes because I can't do anything.
Yeah. Well, that makes sense. I mean, I just wanted I think that's important for our listeners. If there's any concern, I mean, what are you looking for? It's because there are things that people can be like, I'm not quite feeling right, and I haven't for a week, and I'm not sick, but what's going on here? That
Right.
Did I hit my head, or did I whatever? So
I think on the energy side, it's just validating them, and saying, when you're tired, it's okay post concussion to wake up in the morning and not feel like you're rested.
right.
It's okay to tell your parents you got to take a nap, because your brain's not fixed. Your brain's injured, and it's going to be that way until we get it repaired. So validating them and helping them feel normal in what we talked about last podcast is, this is the invisible injury. They're gonna feel like, especially if they go to certain providers and there's no clinical finding on the scan. The patient's gonna feel, is it just me?
Right.
I had where'd I put it? I'm going through my notes here. I had another question I was going to ask you there, but
By the way, I got one too at the very end if we have time.
yeah, go ahead. I know we're coming up on
All
time,
right.
Chris.
Yeah.
I'm gathering my thoughts and I can't find it, so go ahead.
All right, so Dr. Luckey, this is purely your opinion thing, because not only did we have somebody bring this question up, John and I were asked this question by listeners after the fact, and honestly, this was so far beyond our pay grade, we didn't even have a reasonable opinion. But let me kind of set the stage. John might know where I'm going with this. But we had Dr. Cruz on the podcast. This was, our first one, John, I believe. And he brought
I know
up
where you're going,
like a 70-some-odd-year-old gentleman that was a patient of his, was told by 2 orthopedic surgeons he needed to have a hip replacement.
Mm-hmm.
Well, Dr. Cruz is like, before you have that done, before you get cut on, then come see me. Let's do a workup, whatever. So Dr. Cruz looks in his eyes, whatever, and then from what he sees in his eyes, he does an MRI of the brain, finds a lesion on his motor cortex, or John, I think it was motor cortex. I don't remember even exactly where the. Anyway, it was not a tumor like a cancerous tumor. It was just a lesion.
Yeah.
And
Yep.
that was, and Dr. Cruz told him, you don't need a surgery. You need to go get in good sunlight or it's like, go take a vacation. This was a wealthy gentleman. He did so. And sure enough, 2 or 3 weeks later, hip is fine after hurting for whatever, 2 years. So my question is there a way for a brain, for soft tissue injuries to heal, things that are not supposed to heal, like arthritis in this case? Can those things heal with proper brain brain, whatever
Yeah.
the right recipe to help the brain? I mean,
Yeah.
that's, and we
I
were
yeah. Chris, I lost just the last part of that question, but I think I'm appreciating what you want my opinion on.
yep.
Um, I first of all, Dr. Cruz he's top of the food chain. I think he's in a world of his own, and he's just fascinating. He's brilliant. Um, I think many of his theories will be proven to be accurate in time, if they're not already. Um, I have come to appreciate the more that I do the work that we do here at the clinic, the more I appreciate that everything downstream of the brain can change when the brain's in a new neurological situation. Um, I would be a bit hard pressed to think that degenerative change that has developed over decades is gonna have a nice surprising turnaround. Um, However, what I do appreciate is that when downstream regulation of your postural, like big words, right? But vestibulospinal reflexes, which hold you upright, stabilize your spine. I've seen changes in scoliosis that these people thought they had it for 30 years. And you change their vestibular system, and all of a sudden, a 35-degree scoliosis is 12, you know? And I so I have seen some pretty dramatic things, and we never touched their spine, right? Those were neurologic changes that changed the multifidi and the paraspinal muscles and posturing. And so, do I think that it's part of the equation when somebody's trying to evaluate life in their 50s, 60s, 70s? Evaluating like functional brain health is a huge ingredient. Um, I'm not sure if I gave you the answer you're looking for.
Well, I'm not looking for an answer. I was kind of looking
Yeah,
for, how in the world does this work? I mean, now
yeah,
granted, he never said if the gentleman's hip regenerated. He said the
yeah.
gentleman was out of pain.
Oh,
So
well,
I don't
yeah. So,
know.
yeah, well, here's what I would say to that. I would say that's highly plausible, right? So, think about this. If somebody sustains a stroke event, right? They now say they get a stroke on the right side of their brain. What do, right? They start posturing. They go into flexor dominance on that hemisphere of their body. Well, they go into flexor dominance because the brain can no longer regulate extension. And extension is the anti-gravity. That's the Superman effect, right? Is your extensor musculature to be dominant, right? So what I'm trying to say is if you improve somebody's neurological state to the point where their subconscious extensor system is radically more profound and more robust, is it going to take load off joints? Is it going to take pain out of joints? Is it going to change posture? Is it going to make them feel younger and more virile? Is it going to make them produce more power and be more stable on their feet? Yes, it will. So yeah, you can change neurologic state and absolutely have a joint impact for sure. Yeah,
Nice.
yeah.
Last thing we'll touch on, because I know we have. Are you good on time? You have another
I'm
5
good.
minutes here?
I'm good. Yeah, 5 minutes is good.
Yeah. You've talked about glutathione a couple times. I think you talked about it in the first episode as
Yep.
well. But I mean, what role does that supplement and any other supplements that
Yeah.
you recommend having concussion health
So,
or restoring health after concussions?
so glutathione is made by the liver. It's just a really powerful antioxidant. Not that you can really take an oral antioxidant, and not that it's specific to any part of the body. Here, fellas, in 1 second.
Yeah, is your phone about to die?
Oh, maybe that's it.
Yeah, because I just got a thing that said you're recording. You weren't recording
I've been plugged
anymore.
in, but maybe I'm still burning fuel here. Anyways, I'll try to get through this. So anyways, where was I? The liver makes it. Sometimes I'll have them take 2 cycles, but you don't want them to take it all the time because you don't want the body to habituate it and not make its own. So that's important. I'm always a big fan of omega-3s because the brain just needs fat. So this is just a very generic, very easy recommendation. From a supplement and nutrient standpoint, there's really not much that I give. Those would be your major players. There is, what else did I want to cover there? People are doing a lot of oxygen therapy, but I think the research is swaying a little bit more towards hydrogen therapy for the brain right now. So that'll be an interesting topic that maybe make a note of that and dig into that a little bit, because I think that's going to be a new wave.
Hydrogen therapy. All
Yeah,
right.
as opposed to oxygen, as opposed to the compressed oxygen chambers.
Nice.
I have a lot of colleagues that are starting to go that direction.
Interesting.
Yeah.
Why? Now I
You know
want
what?
to know.
I haven't. It's on my desk. I have a stack of research that I got to go through to figure out what application it has for us yet. I know very little on it right now. I just know that some people that I really, really trust are beginning to use it. So I don't have a great answer for you yet.
Okay. Yeah.
That'll be episode 3.
Yeah, episode 3. I'll be ready.
Hydrogen therapy. Yes.
Yeah. All right. We'll go ahead and call it there. No, we're starting to run low on some data recording here, so we'll go ahead and call it. And have any of your handles or anything changed? Where can people find you?
Yeah, Pittsford Performance Care. Instagram is probably the easiest for people. We have a kind of a new social media launch that'll be happening here in the next month that I'm pretty excited about. So if people are interested in what we're doing, there's going to be a lot of educational material that'll kind of be hitting. But in the short term, Pittsford Performance Care for Instagram is probably the easiest.
Cool. Well, I appreciate it, Doc. Appreciate you taking the time to join us again. I know everybody listening does as well, so thank you very much.
Yeah, you're welcome, guys. Appreciate what you do, and appreciate the time.
Thank you.
You bet.
All right,
Anytime. That's the show, guys.
All right.
Pay your dues. Share the show.